my name's Kennedy Sexton, and today I'm going to be demonstrating the IV med push and the IV piggyback skill. During both of these procedures, I would make sure to follow all GPSP. I would perform my 11 rots, and I would also perform my 3 medication checks before giving any meds to my patient. So first things first, I've checked my patient's MAR. He's been ordered Lasix to be pushed over the IV. So I've pulled the med and checked it once. It's not contradicting with anything that he's getting currently. So we're gonna go ahead and assess his IV site and push the med. So knock. Hi, my name's Kennedy. I'll be your nurse today. Can you tell me your name and date of birth? The name and date of birth matches. And can you tell me if you have any allergies? They report no allergies. And are you having any pain at your IV site at this time? And they said no. Everything looks good, so we're gonna go ahead and get started. At this time too, I would also perform any assessments related to the medication that I was giving as well. Okay, so now we are going to assess this IV site. Everything looks really good. No infiltration, no abnormal swelling or anything. And I'm also gonna check my med once again. It's lined up with my saline flushes, so my med's been checked twice. And I'm gonna clamp this tubing. We're gonna go ahead, take this cap off. I'm gonna get a clean alcohol swab. I'm gonna scrub that hub thoroughly and let that air dry. I'm gonna get my first saline flush. And we're going to push. We're gonna aspirate, checking for blood return. Okay, everything looks good. No abnormal swelling. My patient reports no pain. Get a new alcohol swab. I'm gonna scrub the hub. Let that air dry. Now I'm gonna check my med a third and final time. And I'm gonna push this at the prescribed rate. Monitoring my patient, making sure that there's no infiltration. He's not in any pain. Everything looks good. Getting another alcohol swab. We're gonna scrub that hub again. Let that air dry. And now I'm gonna get my saline flush. And for this one, we're going to push this flush at the same rate as the Lasix. Once again, assessing my patient, making sure they're in no pain. Everything looks good. I see no complications. Okay, we're gonna scrub that hub again with a clean alcohol pad. And then I'm gonna get a new disinfection cap and put that on the hub. Okay, and then I would start the primary again. Everything looks good. My patient has had no adverse reactions so far. So then I will take these off. Perform hand hygiene. Then I would leave the room and report giving the Lasix immediately. And then I would come back in after about 30 minutes and assess my patient, make sure there's no adverse reactions, and perform any other proper assessments. So now I'm going to perform the IV piggyback skill. So with this, I'm going to check the MAR, the medication that my patient has been prescribed. The piggyback, I'm going to check that and make sure that there's no contradictions with anything that my patient's getting right now, or any of the dilutes or anything that's being given with it. And I'm also going to perform any proper assessments related to that medication as well. So I'm going to knock. Hi, my name is Kennedy. I'll be your nurse. We're going to hang a IV piggyback to your primary line. Can you tell me your name and date of birth? Name and date of birth matches. Do you have any allergies I need to know about? They don't have any allergies. And do you have any pain at your IV site right now that I need to know about? They said no, everything looks good, so we're going to go ahead with the piggyback. I'm going to perform hand hygiene. Once again, I'm going to assess this site, assess my patient, make sure that there's no infiltration, everything looks good. And then I'm going to prepare my secondary tubing. So we're going to get this hanger. We're going to drop this primary bag down. Okay. This cap is clean. I pulled it out of the bag with the cap on it. My materials were within the expiration date and my packages were clean and dry. This would have been on there. Okay, so I've got our new clean tubing. I'm gonna take this, get my piggyback, maintaining aseptic technique. I'm gonna spike this bag. We're gonna hang it. Okay, we're gonna make sure this chamber is halfway full and that our tubing is indeed clamped. All right, now we're gonna slowly prime this line, making sure not to lose any or too much of this medication that my patient is being prescribed. Okay, cap is clean. Perfect. We're gonna hang this here until we're ready to use it. Okay, so now that that's all set up, my other bag is lowered. And now we're gonna access the port closest to the pump. So that would be this port here. We're gonna take this off. I'm getting a clean alcohol swab. We're gonna scrub that hub thoroughly. All right, we're gonna let that air dry. We're gonna get our secondary gonna get a clean alcohol swab. Scrub this just to be sure. Alright. Now that that is all done, we're going to check our tubing and we're gonna set this at the prescribed rate for my patients. Now we can see that this one is running, my piggyback, this one's not running. My patient looks good. Everything seems to be running smoothly. And I would monitor my patient periodically, making sure that there's nothing wrong with this piggyback, nothing wrong with his IV site. And then after my piggyback is done, I would come back in the room, ask 2 patient identifiers, allergies, all of that good stuff, and then we're gonna discontinue the piggyback. So I perform hand hygiene. My patient's reporting no pain. Everything looks good, so we're gonna go ahead and clean this. This will be dry. I'm gonna get a clean alcohol pad, scrub the hub, and I would get a clean disinfection cap, put that here. Okay, now that this is all unhooked, we can discontinue this appropriately. And we can put our piggyback back to its original set. It's dripping good. Everything is at the correct flow rate per my patient's order. No adverse reactions. I would make sure my patient didn't need anything further, and I would leave the room and document immediately. I would also document after hanging my piggyback first and left the room. I would also check on them periodically after I hung the piggyback and document immediately. And then as this primary is running, I would also come back in and assess my patient periodically with that as well, and then report and record.